Lifers, we are doing this. I'm at the end of my workout, and at the end of the workout, we're going to do 5-minute fitness. But before we get started there's a couple things that we need to talk about that are really important. So yesterday I talked about DVTs. Let's talk about DVTs in pregnancy. This is a high morbidity, high mortality issue that happens in women. If you get a DVT in pregnancy, and some of the things that could happen to you with that is you could get a blood clot in your legs. If you get a PE, that's a blood clot in your lungs. The symptoms that you have associated with that could be that you have swelling in one leg more than the other one. You could notice that you're having your leg is literally getting bigger. You can have pain in the back of your calf. And then if it's going to your chest, you could have shortness of breath. You could have chest pain. If you have any of those symptoms, make sure, number one, you always have a primary OB provider. So that could either be an OBGYN, a family medicine doctor, or a midwife. And make sure you let them know about those symptoms. Yes, in pregnancy, we do have some of those symptoms naturally, but if you're noticing things more on one side than the other, if it's just unnatural to you, you're not able to take a deep breath or lay back, then we want to know about those things. The other things with DVT in pregnancy, we're going to have to do imaging, okay? Everybody gets scared of imaging. It's okay if we need to do imaging if it's to save your life. We want to save your life. We want to prevent bad things from happening to you. So we're going to do imaging. The other thing that we're going to do is we're going to put you on medication. Yes, there is nothing natural that can unblock or break down a clot that I know of. So if somebody else has something out there that's natural that can break down a clot that's in your veins, then please let us know. But otherwise, we're going to put you on medications, and we're going to put you on those medications for the rest of your pregnancy. When we get to a certain point, those medications are going to be shots. So I apologize, but we're going to have to take shots. We're going to take shots every day. When we get closer to the time of delivery, your doctor may actually recommend that they switch from one medication to the other one, or keep you on the same medication that you have. And when it's time for delivery, remember, you are at higher risk of postpartum hemorrhage as well as developing another DVT afterwards. So make sure you are aware of those signs. And please stay on top of your medications. And thirdly, keep in communication with your doctor. So now let's get to that last 5 minutes of fitness that we want to do. We're going to just start with a little squat. You know me, I always start with a squat. So let's go down. We're going to do 10 of these. And if you want to jump squat it, then you can, okay? Take it back with 4. And then we're just gonna go into some boxing with it. Right, right, left, right, left. And we're gonna get an uppercut with it. Uppercut, uppercut. And we're gonna punch. Punching bag, punching bag, punching bag. And everything, has a little bit of music with me because I love music. Other side. Punch. And look what you're doing. Make sure you have a good form. Keep that belly tight. You can do this in a chair. Let's go. Let's go. Let's go. Alrighty. Knee, knee, knee. And let's go 5, 4, 3, 2, and switch. Four, 3, 2, and switch. Down, up, down, up. Let's go. Get that squat with the punch. If you need to slow it down, then slow it down. If you want to add a jump to it, then add a jump to it. Once again, you can do this in your chair. If you're in a chair, up, up, up. All right, let's turn around. Let's go. Up. Yes, I know it's Sunday or Monday morning, but we got to get it in. 5 minutes of fitness. This is the end, mind you, end of my workout. So I'm already glistening, sweating. Yes, I sweated my natural, beautiful hair into its natural curls. Let's go. All right, let's go from some leg lunges. So I hope everybody's having a wonderful weekend or start to their new week. Remember, I, Dr. Elmore, am not your personal physician, but I'm an encouraging physician, and I'm an empowering physician. And I want everybody that I know, whether you're my client, whether you're my patient, or whether you are just learning from being online with me, I want everybody to be healthy, happy, prosperous, and at peace. Every day, all day, as much as possible. Reverse lunge. Let's go. Remember, your knee should not be over your toes, okay? Your knee should not be over your toes. And we're gonna get in. Next thing, alrighty. So if you can't do these fast, then do them slow. Basically, side lunges, all right? But you can add a little hop skip to it, okay? Side lunges. Once again, knee should not be over the toe, which means you need to stick that bottom out to the back. And if you can't go fast, then slow it down. Alrighty, let's do a little floor exercise because we are almost done with our 5 minutes of fitness. All about the side kicks. Let's get them in. Make sure those hips are tight, that you're in alignment with your body, that you're breathing. At the end of this, make sure you get some water. As a matter of fact, have water at your bedside, have water in your car, have water wherever you are so that you can rehydrate. Our body is made mostly of water, and we need to rehydrate those cells. So let's get it in. And you know, to have those ripped abs, they're under here, we gotta do some type of abdominal workout. So let's get that in as well. We wanna viva life, boom. We wanna thrive. And if you ever have any bone issues, then find an excellent orthopedic surgeon. I know one, she's my best friend. She's awesome. Leah Brown, Dr. Brown, yeah, totally. Let's go. And you know what I found? You do 50 of these a night, you will see a difference in your abdominal muscles. Yes, we need to get rid of the fat too, but we can do all of that at the same time. Diet, nutrition, portion control, exercise, drinking more water than we do sweet drinks, soft drinks, and all those other kind of drinks. Very good. Woo. Let's go. Hope y'all can still see me. Isolating that abdominis. We'll talk about the diastasis recti. And people, especially postpartum, people have that. Yes, I still have mine. But I can keep it under control with my ab workout. And how I eat. And really how you stand in your posture. So, really important. And that's it. That's all we have for today. Remember, DVT in pregnancy is very real. It unfortunately causes high morbidity and mortality in women of color, pregnant women, and people that are more sedentary or have cancer. So remember those things, but be positive. You can achieve and you can do anything that you put your mind to. Just meditate on it, just affirm it, and just do it. Have a great day. Viva life.